There are several key points on the back which we should cut, and they are the points around the shoulder blades. So the first 2 points which we've identified and cut are at the top end of the shoulder blade, in some cases it might be necessary to place the patient on his stomach lying down. This is especially the case if the patient is elderly, but if he's a young gentleman like we have here, it's fine for the patient to remain seated while the back is cut. The person doing the cupping should be fully conscious of how the patient is reacting. In this particular case, there is a mirror, and our resident cupping expert keeps an eye on the patient's facial expression features, because anything could happen at any time. Although it's very rare, there have been some extreme cases where the patient has fainted, and while fainting also wetting themselves as well in the process. But this is very rare. On the whole, the majority of people are able to endure cupping throughout much of the body, in particular the back, which is the most commonly cut part of the body. So we're not acting irresponsibly by plastering the whole of the back with a myriad of cups like you see on the internet and on various pictures. We're just doing 2 cups at a time. Okay. And these are fairly large cups as well. So I would say with three of these cups positioned along the length of the shoulder blades, we can pretty much cover much of that region. If you need help identifying exactly what parts of the back to cut, get the patient to basically invert his arm backwards so his shoulder blades protrude. When he does that, you'll see the corner of the shoulder blade, and that's where you need to begin your cupping process. So cupping the back is very good for general health and well-being. It's like having an MOT of the human body. It's very good for the immune system. cups are placed alongside each other until they reach the bottom corner of the shoulder blades. We've already washed these points we're about to cut. And there are very few nerve points in the sense that it's not a sensitive point to cut at all. The patient feels hardly anything. Maybe a slight tingling. So we can see the expression of the patient's face. As you can see, he's smiling under no discomfort, quite capable of tolerating the suction process. Women might be a bit more squeamish. These are also points of significance in that it's sunnat to cut these areas. These points have been explicitly stated in hadith for the benefits that can be derived. So the area you actually cut is highly dependent upon the point upon which the patient has pain. For example, if he has a headache, then cupping the back won't be of great benefit. You have to cut the head. The back is excellent for general all-round health and well-being. But if the patient has a specific point of discomfort and distress, then it's important to cut that area and not to overemphasize the back. Depending upon the nature of the complaint the patient has, if he has a particular problem in this region, then it would be wise to cut the area repeatedly, perhaps 2 or 3 times. If there aren't any problems and it's just for general MOT of the patient, then once is sufficient. The final point we'll cup on the back is the topmost part of the spine, just underneath the back of the neck, where we have the protruding bone. Vertical cupping, as we've demonstrated previously. The reason the cuts are done vertically and not horizontally is because if, for example, at this point the patient moves his neck forward, the cuts would expand and become bigger. But if they're done vertically, there's no risk of that happening.
Is the best antibiotic for sore throat, nose and sore throat. Herb 100%, no side effect. Panacea and golden seal. many people. I have one sister, every 3 months she got the antibiotic. Course same. When I gave her this one 5 days, that's it, the sore throat is gone. She's surprised.
For children also okay?
Well, read inside, wallahi, I think it's herbal. Well, it's a good point. I have no idea. Can you read it?
Yes, it says keep out to reach your children. It doesn't say do not give. That's very clear.
So the final point we're going to cut is the position right in the center of these 5 spots. This is actually on the spine itself, just as the previous spot was. So everything is aligned. This is along the spine itself. The cups weren't just placed randomly at any spot. They were carefully selected in accordance with certain precise spots which we're aware of through historical practice, through religious texts, in this case hadiths, about sunnah spots, and through practical experience as well. as a precaution, after the cupping, the patient should try to refrain from driving or travelling. In other words, take a rest, because his energy levels would have been somewhat depleted with the extrication of so much blood.